Okay, so our country profile was over India. Some of the population health indicators are their life expectancy. Life expectancy is the measure of health status in a population based off of the number of years people live. In India, life expectancy for men is 67 years, and for women, it's 70 years. Comparing this to the United States, our average life expectancy is 78.87 years, a bit higher than India's. Next, we have under 5 mortality rate, and this is important because if a child reaches age 5, they are likely to survive into adulthood. This is measured by the number of deaths due to any cause in kids between 2 and 5 per 1,000 live births. For India, the under 5 mortality rate is 37 per 1,000 births, which is much higher than America's 6.89 per 1,000 births. Next, we have the crude mortality rate, which measures the number of deaths of all causes within a population during a certain period of time. For India, their crude mortality rate is 7.27 deaths per 1,000 persons. This is a little lower than America's 8.5 deaths per 1,000 persons. We then have the cancer incidence rate, which measures the number of new cases of cancer within a specific population and time period. India's rate is 83 per 100,000 persons, which is considerably lower than America's at 470.7 per 100,000 persons. Lastly, we have the maternal mortality rate, which is a measurement of mothers who die during childbirth per 100,000 persons. In India, the maternal mortality rate is 122, which is extremely high in comparison to the United States, whose is 16.9. Next, we see the social determinants of health in India. Some of the main determinants in India are their poor sanitation. This is due to indoor households using biomass fuel as their energy source. Using this can create health issues within people living in those houses. The next major determinant is the malnourishment of children under the age of 3. Without certain nutrients, children can develop certain diseases. Another determinant is the employment conditions. In India, less than 25% of employees have job security and only 15% of employees receive benefits. This plays a huge role in being able to not only have assurance of a job, but also the impact it has on someone's financial situation. Lastly, India's gender inequality plays a role in their social determinants of health, as it creates gender gaps in education and jobs. India's health challenges are both dealing with diseases and those outside of disease. Some of the most common diseases that the Indian population face are influenza, malaria, and tuberculosis. Since TB is one of the most common causes of death in India, the CDC has been working to effectively treat, prevent, and diagnose the disease. As far as the flu, monsoon season in India brings a variety of airborne infections, which results in the rise of the flu during those times of the year. Challenges outside of diseases include low levels of health care, social inequality, and limited medical research. Poor people that live away from the cities are at a big disadvantage for health care. Majority of these people cannot get the medical help they need and instead turn to home remedies to help with illness. Lastly, the healthcare system of India is considered as decentralized and has both private and public sectors. They do believe in the right to health for everyone as a part of their public system, and they provide free and subsidized health care for those below the poverty line. And these are some of the references and sources that we use to complete this project.